Hello, everybody. A case study of a patient with cirrhosis of the liver will be presented by Megan, Tara, and Jaslyn.
Mr. Palomalu is a 72-year-old male admitted for abdominal pain and symptoms related to cirrhosis exacerbation. His ethnicity is Samoan and his religion is the Church of Jesus Christ of Latter-day Saints. After the paracentesis, the patient tolerated the procedure well and is currently resting. He was given midazolam for sedation and the physician ordered bed rest. The patient is currently NPO and receiving TPN for nutritional supplementation. He was given his first dose of spironolactone. It is recommended that the nurse assess for signs of bleeding frequently, complete the ordered CMP to monitor electrolytes, continue to assess frequently for complications from the TPN, assess for signs and symptoms of infection, assess for signs of alcohol withdrawal using the CWA protocol, refer to case management or a social worker for alcohol abuse treatment, provide the patient resources for AA meetings locally, and provide post-procedure education including site care and medications.
The patient's cultural and spiritual values are important factors when providing care. Considerations for the Latter-day Saint includes clothing preferences and practices such as wearing undergarments that are only removed for the purpose of laundering and personal hygiene. These garments can be removed for medical reasons but must be cared for and replaced with clean ones when done. They also follow dietary rules that include not drinking tea, coffee, or alcohol. They also often perform blessings for those who are sick. This is when male elders of the church pray over a member who is sick, asking for healing. In the Pacific Islander culture, it is important to understand that the basic unit of Samoan society is the extended family, and decision-making is often the family matter. Lastly, allowing for visitors to stay with the patient provide moral support. Gerontologic considerations for a patient with cirrhosis includes increased risk for developing multiple complications, elevated accumulation of excess fat in the liver, decreased metabolism and detoxification, decreased renal functions, higher risk of hepatotoxicity, increased risk for interrupted skin integrity, and cardiac rhythm changes. The liver performs many functions. It helps make blood clotting factors and bile, which helps carry away waste and break down fats in the small intestine during digestion. It produces certain proteins for blood plasma and processes hemoglobin for use of its iron content. It also helps remove toxins like alcohol and drugs from the body by clearing the blood of drugs and other poisonous substances, and resisting infection by making immune factors and removing bacteria from the bloodstream. It also regulates blood levels of amino acids and clears accumulation of bilirubin. Lastly, it processes cholesterol and maintains normal blood sugar levels by producing cholesterol and special proteins to help carry fats through the body, and by converting excess glucose into glycogen for storage and to balance and make glucose as needed. There are many factors that cause or lead to cirrhosis. Drinking excess amount of alcohol is the most common cause. Alcohol is toxic to liver cells and damages the liver by changing how the body breaks down food. Hepatitis infection are caused by viruses that are spread from exposure to the body fluids of an infected person. Some infections go away on their own, others may last a long time and lead to liver inflammation and injury. Over time, this can lead to cirrhosis. Some inherited disorders cause problems with the way the body works or with the way the liver works. This can lead to liver damage. Examples include hematochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency, and galactosemia. Health problems that damage the bile ducts can cause bile to back up and damage liver tissue. Other causes of cirrhosis includes hepatic congestion, long-term exposure to toxins such as arsenic, and severe reaction to prescription drugs such as isoniazid and methotrexate. Also, another cause is non-alcoholic fatty liver disease, where a buildup of fat develops in the liver. This is associated with diabetes, high triglycerides, coronary artery disease, obesity, intestinal bypass surgery, and long-term treatment with corticosteroids.
So, medication teaching. So, this is a nurse's job to educate the patient on their new medications that they may be on. One of the more important things is the metabolism of medication. So, since their liver is failing, dosages are changed because the liver cannot metabolize as well as it used to be. So that is important in telling the patient that, and also telling them about certain medications that have a big effect on the liver. So also they would be on medications to prevent bleeding, like a beta blocker. So the beta blockers work by decreasing the heart rate, and it also helps with the hepatic venous pressure, which decreases the chance of bleeding out, because many people who go into the hospital, which is about 20% of people with cirrhosis, will have a GI bleed, and so they should be started on antibiotics once they get into the hospital.